Okay, hello. So my wife is at work today, and so she wasn't here to keep me from getting down into the basement. So, as some of you know, I was in the hospital last Thursday. Had a bit of an issue with, well, I guess on Thursday morning I woke up and my back was kind of numb. Had like a band stripe across your back that was numb, which is probably the first sign that something was not right, but I of course ignored it. And then later on, about like lunchtime or so, I started noticing that my hands were starting to get numb, tingly, and of course I blew that off as well. And then about 4 o'clock or 4:30 or so, something important stopped working, and got all, my tongue went numb, got lightheaded, dizzy, nauseous, face went numb. Yeah, that didn't feel too great. Coworker went over to a coworker, and they called 911. Ambulance showed up. I don't even there's sections I don't remember. I don't remember getting from like my cubicle over to the front lobby, and we have like our first responding team that comes along and helps out in these situations, and they were around. And then I was loading up the ambulance. I think they started treating me assuming that I had a stroke, but it wasn't. It was this transverse myelitis problem that I've had before. About 6-7 months ago, had an issue with that. This is a lesion in your spinal cord. But now they think it's MS, since I had an acute attack, and they've run a bunch of blood tests and everything. But this video is, I got my DVD that has my brain. Well, it's the MRIs that they did, and I hid. This is kind of cool. I tried to figure out how to do this. The laptop's actually, I can't hold the camera or the cell phone. It ends up being really shaky. So I've got some of my other videos. I have this like little board that I stick underneath my oscilloscope, and it creates a cantilever that I just set the phone on, and that's what I'm using. And my laptop is actually on the table. This is the workbench. So like if I were to put a pen or a screwdriver, that's gravity is going down. So it looks like it. I turned off the light. It actually looks pretty decent. I hope it comes across. But anyways, here's my brain. So it's kind of neat. I don't know how to read any of these because they've got, they tell you spots and things are bad, but I see a whole bunch of spots. So I'm not a doctor. I don't. I've also got still fighting a cold that I've picked up at the hospital, so it's probably like a really good one. But anyways, we'll just flip through. I think that's cool, like the MRI machine. I was in there for, they did my brain, my neck, my back. And it took about, I think I was in there for 2 hours and 10 minutes, or 2 hours and 30 minutes of scanning. And all that work, and you get all these little images, which are kind of cool. Trying to remember. I don't know what all they mean, what they do, but I do know that. Oh, my computer. There it goes. I know about the one that's in my neck. So I think. Let's see if I can find it. It might be later on here. Or is it this one? Yeah. This is their little program that comes on the DVD, and it's like not for clinical use and all this other kind of stuff, but I don't know. Let's see if I can find when they do it, the doctors, they show you these things. They know how to use this, so they can find it pretty quick. Oh, here we go, here we go. Let me go back up one. So, this little spot right here, they tell me is bad. The interesting thing is now, if you hold down, I'm trying to remember, if you hold down, yeah, this button, you can move, like, this is what the doctor does. He's like, oh yeah, you can see, and then they move things around. They're like, oh yeah, see this little spot right here? Oh, that's not good. That's causing problems. And then you're like, oh yeah, that looks bad. Why is that there? But they don't know. That's what they're working on. So that's like the main problem. So this give you, let me go back to where you can actually see stuff. Yeah, now I got all messed up. But this up here is the brain, and this is your spinal cord coming down here. These are your vertebrae in through here, and I know from the diagnosis that this one is like T1, and this is C7, so it's cervical 7 if you count somehow, you know, but 7. And then the thoracic spine starts around in here, because they say that it's between the T1 and the C7. So this little spot is causing all kinds of issues, problems. But yeah, I don't know. They're gonna try to figure out something. But I'm always amazed. I mean, the detail on these pictures is pretty amazing, considering they sit in a tube and they microwave you, and that causes little water molecules and stuff to align with the magnetic fields and snap back, and they measure the little, I guess, photon. Well, I guess it's not photons, but the energy radio signal that pops off of them. They have little antennas and pick all that up, and then a bunch of processing happens. Actually, the kind of cool thing is the guy that got the Nobel Prize for developing the MRI machine actually went to the University of Illinois, or he was a professor here, which is kind of cool. So I'm using his technology. The guy's, I really should know his name, but I don't. But he's no longer alive. He passed away a while back, like maybe 3 or 4 years ago, because they had, I remember there was a big thing in the newspaper about it. But yeah, anyways, so this is kind of cool. You can look through and see all kinds of neat stuff, and I have a whole bunch of images in here. Well, that one's like way blown out. I think I messed it up. Yeah, don't know what it was supposed to look like, but I don't know what that is. That might be looking down my neck, maybe? Probably. You probably find that spot again somewhere in here. I guess this is the spinal cord, right? Yeah, I don't know. Like I said, not a doctor. But, there's... Oh, it's gotta go read the DVD again. But as you can see, there's a gazillion images on here. And they're all of, like, stuff. But yeah, that's kind of cool. So, got that. They did, like, a whole bunch of blood tests on me. It was really not fun. I still got a bunch of bruises on my arms from when they took all the blood. And I got bruises in my stomach. They were giving me shots in my stomach. I had IVs hooked up 24 hours, 7 days a week. Well, 6 days. I was in the hospital for 6 days. Is that right? Yeah. I went in on Thursday and I got out on... No, I went in on Thursday and I got out on Tuesday. They finally released me. And as I was leaving, they're like, oh, hey, we need to take another 9 vials of blood. I'm like, what? So they took even more blood while I was leaving, which is kind of, I mean, they're doing their job. They're trying to get everything up and running. So my next big battle is with the insurance company, because of course they're not gonna so we have 2 neurologists here in town, and I've seen both of them, Dr. Erickson and Dr. Banzel, and they're both recommending that I go up to Chicago for treatment or to put together stuff, and of course that's out of network, because that would, what's hilarious is, had it happened before February, it would have been in network. But now they've changed the doctor list, and so now that's out of network. So I'm trying to get the insurance companies like to place the burden on the patient, of course. So I have to go, and I've got stuff in the works trying to get my referrals and pre-authorization and all that, so I can just go up there and see this doctor, because the end goal is we just want to get some medication that prevents these acute attacks from happening. Actually figure out, is it MS? It's like it looks like transverse myelitis, but it's acting like MS, so they're like, oh, we don't know. So that's where they want to go see the specialist, who specializes in transverse myelitis and multiple sclerosis. That's his thing. So, anyways, yeah, there's a bunch of pictures in here. I don't know what they mean. They all look kind of cool, though. I've seen where people like take these and 3D print. Like, you can 3D print your skull. That'd be kind of cool, except I don't think, to me it doesn't seem like there's enough information here, unless this doesn't let you, like, maybe it just has to interpolate a lot. Seems like there's just a bunch of slices, but maybe I don't have, I mean, there's a lot of data on the DVD. It looks like it's almost full, so maybe these are just the images, like, when they do it, because I'm supposed to take this up there to that appointment. And maybe they go and they have, like, there's probably more on it, and it's just that this is what I can see, or these are the selected images that the technician has highlighted. There's probably all kinds of crazy stuff in here. Like, yeah, I don't know how to use this program, but anyways. Oh, you can measure stuff. Oh, that's cool. Ah, I broke it. Okay, anyways. That's neat. I guess that makes sense. Anyways, it's playing right now. Oh yeah, these are all my test results, because they were running, like I was saying, how they took a ton of blood. So they got all these different kind of things, and I don't know what any of these, like, what is a C-reactive protein? I don't know. I don't know. So it's like, oh, standard range negative, results negative. Okay. Oh, and this is also, the thing's broken. If you hit the back button, it doesn't go back. You have to hit, I don't know how people build user interfaces that are just perpetually broken. You always have to click their button, because it's, I don't know if it's JavaScript, or I guess I could look at it, but that's funny. This is standard range negative, your value positive. Okay, yeah, that's cool. I guess that's bad. You can click on the about this test, and then it does its little thing. It tells you, oh, it's an anti-nuclear antibody, which I guess is a bad thing. What is that even? Oh, yeah, okay, so finding anti-nuclear antibodies in your blood tells your doctor that you may have one of many autoimmune diseases. Your doctor may order these tests depending on your symptoms and your physical exam. So yeah, they're pretty much saying, that's telling me that I've got some kind of autoimmune. I so want to hit the back button, but no, you have to click here. The MS panel, this is the one where they're like, this is my spinal tap. They did a spinal tap on me. Lumbar puncture. If you can avoid that, avoid it. Not a pleasant experience. Yeah, we won't go into that. You get a really bad headache afterwards. They do local numbing, but you can still feel it going in, and it's a big needle. That's not a fun experience. I don't recommend that. I mean, they have to get into the spinal column to take out some fluid, and there's vertebra and stuff in the way, and the needle has to go through the disc to get, yeah, it's not a fun, I don't recommend that, if possible. Skip that. But yeah, this is the big deal. They're saying these, I don't know how to pronounce this, bands, it says that they're present, and I guess that happens. I love the names of some of these doctors, because I don't even know how you would even remotely pronounce this. But that's, I guess if those bands are present, that's kind of checks a box saying that you probably have MS. And again, I can't click the back button, I have to click here. So, yeah, there's a whole bunch of tests in here, but I don't know what they all mean or do. I got a doctor's appointment coming up, and I would assume they go over all of this stuff, so I don't know what they all mean. Oh, hey, I don't have Lyme disease. That's nice to know. Wait, they had to go to the Mayo Clinic? We can't test for Lyme disease in Illinois. That's pretty sad. They actually had to send that to the Mayo Clinic. You'd think they'd have better things to do than to send stuff to Minnesota, but lactic acid? Ooh, that was pretty high. If their range is 2.2, mine's up at 2.2. I don't know what that means. Something filtration rate. Ooh. Greater than 60 standard range, there is none. Oh my gosh. I guess that means that's working. So yeah, I don't know what any of these tests actually mean. Oh, there's the MRI ones. I guess this one's probably, they have a bunch of stuff in here. Blah, blah, blah. Similar to before, subtle area post-midline cervical cord edema covering a length of 11 millimeter, roughly at the C7, T1 level. No abnormal enhancements detected. Resolution of the room enhancement noted last year. Blah, blah, blah. Otherwise stable. So, yeah, it's doing something. So, oh, these are all, now I'm into October. Was that one from last year or this? Oh, that one was from this recent. Blah, blah, blah. Hey, did I have Lyme disease in October? No, I was good with Lyme disease. Did that have to go to the Mayo Clinic too? It did. Okay, why? Oh well, I don't know. Probably makes them more money somewhere. Oh, hey, they did one of these. Oh, that's interesting. That was the other one that said my value was positive. Back in October. On October 1st, it was negative. Huh. So something's changed in 6 months. Rheumatoid. Don't got that. Anyways, yeah, I'm just playing around now. But this video is probably getting super long. Oh, I was gonna show the let me see if I can do this here. Is it like spinal cord? I don't normally type this slow, but my hands aren't as awesome. Yeah, if you could do this, you can get these cool little maps. And I'm trying to see if there's a easy one here. Like, yeah, I don't know. Let me see if I just click on any random one here. No. There's one that I've seen before that's really good. Well, I guess this one's kind of explains it. But, like that C7 T1 vertebra is kind of important. That one's not a very good one. Anatomy of the spinal cord. Yeah, I probably should have looked this up ahead of time before just randomly deciding to do it. Oh, maybe this one. Yeah, can I make it bigger? Oh, well, alright, that doesn't make that bigger. But anyways, once you get below a certain point, then that C7 T1 spot does your arms and your heart, your lungs, your chest, larynx, trachea, gallbladder, liver, diaphragm, stomach, pancreas, spleen, kidneys, small intestine, appendix, adrenals, small intestine, colon, it says uterus. This is apparently for a female. Colon, but, so it's like all the way down, large intestine, groin, reproductive organs, knees, legs, feet. So, unfortunately, if it gets below that C7 T1, everything below there is kind of important. Above it, luckily, is heart, lungs, and chest, so, yeah, higher up you get hands and fingers, elbows, arms and wrists and shoulders, neck muscles, base of skull, so the upper ones will all work. It's just damage below that point that gets messed up. So that's why my legs are really weak. Arms they're weak. Hands are a little weak. Got numbness. It's kind of hard to tell. Like, I know the surface of my desk is plywood, but it feels perfectly smooth like glass to me because I'm not picking up the subtle vibrations of the surface anymore. So that's kind of annoying. It's like you're wearing gloves all the time, so that's odd, but not too bad. You can play around on here. There's a lot of cool little diagrams and things. And there was a really good image somewhere that showed like what everything actually mapped to, but I don't remember what I typed in to find it. Hey, look, there's somebody. Well, that's a big one. Mine's not that big. Theirs is like the size of an entire. But that's probably, this one listed as an injury, but there's a whole bunch of. I'm sure there's a bunch of MRIs. Oh, the other one that was really cool, you probably remember that. If I go to Wikipedia, if I do transverse, I can't spell. Oh, there it is. It's kind of neat because, like, they all look the same. I actually wanted to go to Wikipedia. Has a good. The picture on Wikipedia, the one that's up in the corner, is like. Tell me this is not exactly what mine looks like. It looks exactly like it. So, yeah, that's funny. But so anyways, say I have transverse myelitis, which is acting like MS. So they're gonna go figure out what's going on with that, and yeah. So that's it for this video. It was pretty long. Thanks for watching. Bye.